Welcome to our YouTube channel Medical Subjects Made Easy. Today's topic is rashes and infectious diseases. 1. What is a rash? A rash is a change in the appearance and texture of the skin, often characterized by redness, bumps, blisters, or discoloration. 2. What causes a rash in chickenpox? Chickenpox is caused by the varicella zoster virus. The rash is a result of the virus multiplying in the skin cells. 3. How does the rash in chickenpox appear? The rash starts as small red bumps and then progresses into fluid-filled blisters. Eventually, the blisters break and form scabs. 4. Are rashes common in measles? Yes, rashes are a common symptom of measles. The rash usually starts on the face and then spreads to other parts of the body. 5. Can you describe the appearance of the rash in measles? The rash in measles appears as small, red, and flat spots. These spots may merge together, giving a blotchy or patchy appearance. 6. What causes the rash in dengue fever? The rash in dengue fever is a result of the body's immune response to the dengue virus infection. 7. How does the rash in dengue fever look? The rash in dengue fever appears as small red spots, similar to those in measles. It is often accompanied by other symptoms such as high fever and muscle pain. 8. Is a rash a common symptom in Lyme disease? Yes, a rash called erythema migrans is a common early symptom of Lyme disease. It usually appears as a red bullseye-shaped rash around the tick bite site. 9. Can you elaborate on the appearance of the rash in Lyme disease? The rash in Lyme disease starts as a small red spot and gradually expands into a larger circular rash. It may be warm to touch but is typically not itchy or painful. 10. What types of rashes can occur in HIV/AIDS? HIV/AIDS can cause various types of rashes, including maculopapular rash, folliculitis, and dermatitis. These rashes may differ in appearance and distribution. 11. How is a maculopapular rash different from other rashes? A maculopapular rash is characterized by flat red spots, macules, and raised red bumps, papules. It can appear all over the body and is often associated with viral infections such as HIV. 12. Is a rash a common symptom in meningitis? Yes, in some cases of meningitis, a rash may develop. The rash is usually caused by the presence of bacteria or viruses in the bloodstream. 13. How does the rash in meningitis present? The rash in meningitis can appear as small, red or purple spots on the skin. These spots may turn into larger bruise-like patches. 14. What types of rashes are associated with syphilis? Syphilis can cause several types of rashes, including a painless rash on the palms and soles, syphilitic palmar-plantar rash, and a copper-colored rash all over the body, secondary syphilis rash. 15. How long does the secondary syphilis rash last? The secondary syphilis rash usually lasts for several weeks to a few months. Without treatment, it may come and go over a period of years. 16. Can a rash be a symptom of Zika virus infection? Yes, some individuals with Zika virus infection may develop a rash. The rash is typically itchy and appears as small red bumps. 17. Does a rash always accompany rubella, German measles? No, not everyone with rubella will develop a rash. However, a rash is a common symptom, especially in children. 18. How does the rash in rubella differ from other rashes? The rash in rubella is usually a light pink or red rash that starts on the face and spreads to the trunk and limbs. It typically lasts for about 3 days. 19. What types of rashes are associated with Lyme disease? Aside from the erythema migrans rash, Lyme disease can cause other rashes such as secondary annular erythema and acrodermatitis chronica atropicans. 20. How is a secondary annular erythema rash characterized? A secondary annular erythema rash in Lyme disease appears as multiple round red rashes, similar to a target. These rashes may develop weeks or months after the initial infection. 21. Can a rash develop in tuberculosis? Yes, a rash can occur in some cases of tuberculosis. The appearance of the rash can vary but often present as small, reddish-brown bumps. 22. Is a rash common in Kawasaki disease? Yes, a rash is a characteristic symptom of Kawasaki disease. It usually appears as a widespread red or pink rash, often accompanied by other symptoms like fever and swollen lymph nodes. 23. What are the different types of rashes associated with Kawasaki disease? The rashes in Kawasaki disease can vary, including a diffuse macular rash, a polymorphous rash, and a peeling rash at later stages. 24. Can a rash be a sign of strep throat, scarlet fever? Yes, scarlet fever, which is a complication of strep throat, often presents with a rash. The rash typically appears as a fine red rash that feels like sandpaper. 25. Are rashes common in infectious mononucleosis, mono? Yes, a rash can occur in some cases of mono. The rash is usually a maculopapular rash, appearing as small red spots and raised bumps. 26. Can a rash develop in hepatitis C infection? Yes, hepatitis C infection can cause various skin manifestations, including rashes. These rashes may vary in appearance, from mild redness to itchy blisters. 27. How is a rash different in scabies? In scabies, the rash appears as small, red, itchy bumps or blisters that usually develop in the folds of the skin, such as between fingers, wrists, and genitals. 28. Can rashes occur in hand, foot, and mouth disease? Yes, a rash is a common symptom of hand, foot, and mouth disease. It typically appears as small, painful sores or blisters on the hands, feet, and inside the mouth. 29. Are rashes common in Rocky Mountain spotted fever? Yes, Rocky Mountain spotted fever can cause a rash. The rash typically starts as small, flat, pink spots, which may then become raised and form red spots or patches. 30. How does a rash in Zika virus infection differ from other rashes? The Zika virus rash often appears as small itchy bumps that can spread throughout the body. It may involve the face, trunk, arms, and legs. 31. What types of rashes can occur in meningococcal disease? Meningococcal disease may cause different types of rashes, such as petechial rash, small red or purple spots, purpura rash, larger patches of purplish discoloration, or maculopapular rash. 32. Can a rash be a symptom of shingles, herpes zoster? Yes, shingles is characterized by a rash that typically develops on one side of the body or face. The rash consists of red, painful blisters that eventually crust over. 33. How is a shingles rash different from other rashes? The shingles rash usually follows a nerve pathway, such as the thoracic dermatome or around the eye. It tends to be more localized and painful compared to other rashes. 34. Are rashes common in leprosy? Yes, leprosy can cause various skin lesions and rashes. They can be hypopigmented patches, nodules. If you found this video interesting, please like and subscribe to the channel.